This was a hospital that wasn't supposed to be. Everybody said that you couldn't have a hospital, you didn't have any doctors, you didn't have any money, all you had was land, and you were out there in the country in Great Bridge, so you really couldn't have a hospital.
The 40-year history of Chesapeake Regional is pretty significant. One, it was built on a shoestring. It was built through a vision of not only Dr. Buckley and the community at that time, but a lot of individuals that really put forth the effort to establish this hospital.
All you had to tell my 7 members of the hospital authority that you can't do something, and they were determined to do it. A vision for a 106-bed hospital that could grow to maybe 300 beds. They had the land, 35 acres, and basically no money, quite a challenge. And so that kind of intrigued me. And there was so much excitement from those 7 members that carried over to me as far as the excitement of getting this thing started. My first office was about 6 by 6 in a building down in Great Bridge. And then we got a trailer and everybody was excited. I mean, we took step by step and every step excited us.
It will be 40 years plus 1 week. I started a week before the hospital opened. The pharmacy was located at the front of the hospital where the garden area is now. There was nothing in there. When I came to work for the first time, it was my director of pharmacy. He was trying to do interviews to get more people, and MC and myself were trying to get the pharmacy set up. I was not only the technician, but at that time I was his secretary too.
I was going to college at the time, but my cousin had looked in the paper or something and saw that Chesapeake General was about to open, and he had put in an application. I said, well, I'm going to put one in too. And so I did, and the food service director at that time was Mr. Hested, and he called me, and I went for my interview. And I said, yes, just please hire me. I'll do a good job at work, and he hired me, so.
The Auxiliary is an organization that was formed actually before the hospital started. It started place with Dr. Buckley. It was an idea of coming together with the community, helping the hospital to raise money for whatever they might need, and it's continued ever since then.
Basically, we're here for the community. We're built by the community. The money that was raised here was based on bake sales and car washes and people that were farmers, et cetera, that wanted a hospital here in Chesapeake. We were about 2 weeks away from getting our trailer on the site, and I got a call from Indiana, and they said, we're sorry, your trailer is burned. In fact, there had been a sign on the site, future site of Chesapeake General Hospital. It had been there so long that somebody took paint and painted over hospital and put woods. And so I came into town one night for a meeting and saw that, and I thought, gee whiz, is there going to be a hospital?
When they first started, they had bake sales, and we did, at that time, we had tennis tournaments, we had golf tournaments. Those 2 events were actually taken over by the hospital into a larger fundraising type situation. And of course, our major fundraising is through the hospital gift shop. And that was started at the same time the hospital was started.
Opening day was kind of like winning the World Series. We had a congressman there to speak, along with the president of the State Hospital Association. And it's interesting, the president of the Hospital Association said, in just a few years, you'll be at 300 beds. We actually had a patient come to the emergency room that day of the dedication.
The ambulance came flying down the street, circled around in here, and my boss and I looked at each other and we said we knew it was going to happen. They're probably having a heart attack. We were just at the point of opening.
We had overcome so many obstacles such as regulations, getting approval for the hospital, financial, political. One of the biggest obstacles that we overcame was getting doctors.
The pedigree of medical staff that we've been able to recruit from Johns Hopkins, Duke, UVA, et cetera, are second to none.
There were 12 physicians in the city of Chesapeake when I came, about 5 of them in this area. And when I'd go out to the Western Branch area, they said, you don't need a hospital. We've got Portsmouth Hospital.
I guess we begin with is that we have a very diverse population of employees and community here in Chesapeake. And everyone has their screens based on who they are, how they grew up, their ethnic background, socioeconomic, religious, etc. But we all have the same values. Everyone could expound on the values of excellence.
It's been a family atmosphere from the very beginning.
You know, you walk there in the hall, how you doing today? Everything is up. You know, everybody knew everybody. It was just nice.
The culture began to develop when we were in the trailer. We began to develop that feeling of closeness among even that small staff. I think we may have had 15 or so in the 3 trailers. And then once we moved into the hospital, before it opened, we would all go back to the materials management area and have lunch on boxes.
Well, our culture, I think, is pretty much defined by the people that work here. Very genuine, values-based people. Excellence, service, justice, dignity, and innovation.
I think the feelings that you get by belonging to a community and growing up here and then belonging to an institution as large as the hospital itself is tremendously satisfying. It gives you an outlook of what people are doing on the outside, how things work on the inside, the innovation in medicine in today's society. It's just a joy to be there.
Being proud of being community-based, being one of only 6, I think now it's one of only 4 independent hospitals left in the Commonwealth. Every person I speak to that knows about Chesapeake are very pleased that we've been able to maintain our independence.
The community wants to remain independent. It's an uphill battle. It's going to take the hospital collaborating and cooperating with larger systems. And I think this is what Dr. Bastone is looking at, is, as he describes it, get more oars in the boat and be connected with more major centers.
Our biggest strengths here at Chesapeake Regional Medical Center, I would say, is first our doctors, because their leadership, being champions of certain service lines, make us a better hospital. Defines the staff, the nurses that we're able to recruit, and all the support staff for the hospital to support that practice of medicine. Based on that success, we're able to generate the revenues necessary to bring in the technology and also stimulate our benefactors to believe in that charge of responsibility to contribute to those goals. Our coordination of care, like knowing that the patient comes first, we'll get that patient to the appropriate venue of care wherever possible for the best clinical outcome.
We were going to be personal with our patients, personalized care. But we couldn't do that unless we had personalized relationships between our staff.
It's a very caring environment, not only for the patients, but for the people that work here. We care about each other. If you hurt, I hurt. If there's anything we can do for one another, we're right there to do it.
If they looking, real sad, or they seem depressed or whatever, I might say, how you doing today? Is everything all right? And they might say, my mom or my sister is having surgery or this and that. I said, can I give you a hug? And we hug or whatever. And I said, try to have a nice day. It's going to be all right.
It's really an extraordinary experience to meet a diverse population of people that have a level of commitment to an organization and institution to make sure it's successful. And I think that really is a defining moment for me here, is that this is the first place I feel that truly is, people talk about family, being part of something very, very important. And I think my goal is to use whatever business acumen I have to maintain the independence of this medical center and make it thrive, not just survive, but thrive. And the thing that keeps people coming back to the hospital is that we're going to make the best choice for them. And it's not where we're trying to be everything to everybody. We're just trying to be the best integrator and coordinator of care than anybody.
It's a time to celebrate, but not be complacent. It's a time to look to the future with as much determination as we did, or as we had over 40 years ago before we ever opened.
Our mission is to be the integrator and coordinator of care through a continuum of care. That may be starting out with care, starting in a physician's office, to the hospital, to home care, to a skilled nursing facility, to a rehab, and of which we may not have ownership, but they'll be part of our integrated network through Impact Health or ordination with our medical groups to provide that service.
There were several things that contributed to our overall growth. In 1984, when we got into North Carolina by buying 2 practices and opening the Outer Banks Medical Center. And then as we got additional physicians, it brought us to the need for greater technology. We got the Cancer Center, and along with that grew more surgeries, more diagnostic services.
Of course, the building has changed quite a bit. We started out with just 106 beds at the time. Since then, of course, the technology of medicine has changed. We've gone through those technologies and are improving every day.
When I started, there were no computers, and we did everything by hand.
In terms of technological advancement and innovation, we will continue to be the most progressive hospital in the area of robotics. That's where the future is. The technology that's available for doing surgeries is so precise. Outcome and length of stay and pain is reduced significantly.
The biggest thing right now that we're doing is we have money put into the foundation waiting to fund the mammography mobile.
Primary care may be transitioning into a lot of things being diagnosed radiologically, but also the most important area of us looking to advance is in regenerative medicine. My goal is to really establish an innovation institute here where we can engage not only biotech companies to come and do some of the research here and apply their knowledge and their strategy technologically to a base of patients that are here.
It's a period of being thankful for the growth and support that the hospital has had. And obviously, when I ride by here, I feel pride in what I had a part of. It wasn't done all by me. I was blessed to have people with me to get the job done. Quality of care, the long-term employees, all of these are evidence of success in the past.
I can see now how I've done the 40 years. It's been a fast-moving pace. No regrets. It's a rewarding job because you're helping someone and you're seeing progress.
I just love my job because otherwise you're not going to put 100% all you have into what you're doing. And I try to give all that I have, so that it is a success.
The satisfaction that I think you would get from doing this type of work is giving back not only to the community, but giving back to individual people. There's certainly every type of situation that comes through a hospital. It just gives you a good feeling to be able to give back in the community in some way.
I'm not an important person. I have an important job. And I think the legacy should be about the hospital, not me. If we're able to continue to grow and thrive and remain independent and be great with our affiliated partners, I think I've pretty much completed my goal.